Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of Career in Pharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey. Hello everyone, once again I welcome you all to Career in Pharma. Now this is another episode of important interview questions for pharmacovigilance, and today's topic is what is challenge, de-challenge and re-challenge in pharmacovigilance. Now let me tell you, this is another important interview question, and it is very important to understand these concepts of de-challenge and re-challenge, because once you understand these concepts, you will be able to understand how you can assess the causality, how you can assess the relationship between the drug in question and the adverse event, the effect happened on the patient. It helps in finding out the relation, the cause of the adverse event in any patient. Yes, so let's begin. And remember, this is very important interview question which you can't avoid, which you whenever you are going for interview for pharmacovigilance profile, this is the question which you have to prepare without doubt, and basics should be very clear. Yes, so before I tell you what is de-challenge and what is re-challenge, let me tell you what is challenge. Okay, so now in a layman terms, like challenge means if you accept any challenge from anyone, right? It is like a task, correct? But inside pharmacovigilance, challenge means giving drug to patient. Okay, so in pharmacovigilance, challenge means giving the drug to patient for the treatment. Okay, let's say for example, we are giving augmentin to any patient. The patient comes to us, yes, and patient having a very bad tooth infection, for which we prescribed augmentin. So giving augmentin to patient, giving this drug to the patient for dental infection will be the challenge. We call it as challenge in pharmacovigilance. Yes, so it is important to understand challenge, then de-challenge and re-challenge will be easy. Okay, so fine, challenge is giving drug. Now what is de-challenge? De-challenge means stopping of a drug after an adverse event into the patient. Okay, so let's say in the same example which I gave for challenge, for the same example I will explain you de-challenge as well. Now let's say patient came to you. Patient had dental infection, bad, severe dental infection, for which you gave augmentin. So giving augmentin will be a challenge. Now let's say patient is coming back to you after 2 days of taking augmentin, and the patient is saying, I am having very bad rash all over my body after starting augmentin. So after hearing this, you stopped augmentin. So stopping of the drug after the adverse event in the patient is referred to as de-challenge. So de-challenge is nothing. It is the stopping of the drug after you see any adverse event into the patient. Okay, so this is de-challenge. Okay, now this de-challenge may be complete or partial, or positive or negative. Now let's understand what is this complete and partial de-challenge and positive and negative de-challenge. So complete de-challenge means, let's say in the same example, you stopped augmentin. This is simply de-challenge. Now we will call it as complete de-challenge if the adverse event of a rash disappears completely after you stopped augmentin. That will be a complete de-challenge. means complete resolution of the adverse event. So in this case, rash happened, we stopped augmentin and rash completely disappeared, will be complete dechallenge. Now what is partial dechallenge? So it is very understandable, right, with the word also, right? Complete means complete resolution of the adverse event. Now partial dechallenge means when you stopped augmentin but the rash did not resolve completely. Means let's say the patient had rash all over the body after taking augmentin, you stopped augmentin, and after 2 days patient coming back to you saying that rash has been improved but still I can see rash on my leg, on my hand. Okay, so it is like rash is disappearing but till not disappeared completely. So the adverse event is not resolved fully. This is known as partial dechallenge. Yes. Now let's understand what is positive dechallenge and negative dechallenge. Okay. So in the same case where after taking augmentin the patient had rash. Now once you stopped the augmentin, that is you are doing dechallenge, right? So when you see that the adverse event of rash is disappearing after stopping the drug, this is called as positive dechallenge. Yes. Now this inside this positive dechallenge, the dechallenge could be complete or partial, means there will be complete resolving of the adverse event of rash or it is still resolving, okay, but did not disappear completely. But both will fall under the category of positive dechallenge because after stopping the drug we are seeing that rash has been stopped or rash is still in resolving. So both will be positive dechallenge. Now what is negative dechallenge? Negative dechallenge is even after stopping augmentin, if still rash is continued, that will be negative dechallenge. So our report is negative, means even after stopping, we are considering, we assume that there was a doubt that the rash is because of augmentin. Okay, so we stopped it, that is dechallenge. But we saw that even after stopping, rash is still there. It's not resolving, is still there or might be increasing. So that will be negative dechallenge. Yes. So in this case, not necessary that augmentin is the direct cause of rash. Maybe there is some other factor present other than augmentin which is responsible for this adverse event of rash. Okay. So this is negative dechallenge. So very simple. Challenge giving drug, dechallenge is withdrawing the drug. ओके उल्टा है, चैलेंज में हमने दवाई दे दी है, डी चैलेंज में हमने विथड्रॉ कर दिया है. वी हैव स्टॉप द ड्रग. व्हाई वी आर स्टॉपिंग? बिकॉज पेशेंट में कुछ एडवर्स इफेक्ट आ रहे हैं, कुछ एडवर्स इवेंट आ रहे हैं. नाउ डिपेंडिंग ऑन आफ्टर स्टॉपिंग द ड्रग, डिपेंडिंग ऑन इफ द इवेंट हैज रिजॉल्व कंप्लीटली, दैट विल बी कंप्लीट डी चैलेंज. इफ event has not resolved completely but is resolving, that will be partial dechallenge. And if the event is resolving or resolved, it will be positive dechallenge. But there is no effect on adverse event after stopping the drug, will be negative dechallenge. Yes. So I hope this dechallenge is clear. Now next very important factor to consider for causality assessment is rechallenge. So re means repetition. Re means repetition, means challenge giving drug, re giving the drug again, that is called as re-challenge. Okay, challenge था हमने मेडिसिन दी, de-challenge था हमने मेडिसिन विड्रॉ कर दी. Now re-challenge is we are giving the medicine again. Now किस केस में हम मेडिसिन दोबारा से देंगे? See, if during de-challenge we are sure that the adverse event is not because of the drug we are suspecting, then in that case we will not do re-challenge, right? We don't want to, because we are clear that adverse event is not because of this drug, then why we will verify it. But if the Dechallenge is positive, then we will go for rechallenge so that we can justify, we can verify that this drug only is responsible for the adverse event. Okay, so rechallenge refers to restarting or reintroduction of the same drug after stopping it. Yes, why we are doing it? Just to verify, just to do a final check that drug only is causing the adverse event. Now in the same example where rash happened after augmentin, okay, then we stopped augmentin and the rash also were resolving, or the rash resolved. So there was a positive Dechallenge. Now just to recheck it on, verify, we will again reintroduce augmentin so that we can be confirmed. Okay. Now mind that this rechallenge we can't do in the scenario where the adverse event is some serious kind of thing. Okay, so rash is okay, but let's say if after taking any drug, the patient had some anaphylactic reaction, serious anaphylactic reaction in his or her body, then in that case we are not going to do rechallenge. Okay, so we have to assess when rechallenge can be done. So definitely when Dechallenge is positive, then only we can go for rechallenge, right? If Dechallenge is negative, there is no question of rechallenge, right? So in our example, let's say rash disappeared after stopping augmentin. Now we want to do a final confirmation. So we will give augmentin to the patient again. Okay, so that is the reintroduction of the same drug after you stopped, right? Now again, like we had positive Dechallenge, negative Dechallenge, similarly we have positive rechallenge, negative rechallenge. So positive rechallenge means if the adverse event is occurring again after restarting the drug, will be positive rechallenge. Yes, very simple. See, positive we are using in the sense where our results are positive, means it is in the direction which we are looking for. So positive rechallenge means in our example, if after you give augmentin again rash happened, then it is called as positive rechallenge, and if again rash did not happen, then it will be negative rechallenge. Yes. So again rash did not happen means negative rechallenge. So if it's negative rechallenge, then might be there is some other factor present which is causing the adverse event. Okay. So this is rechallenge, and I hope this concept of challenge, Dechallenge, rechallenge is very clear to you guys. And in this we learned inside Dechallenge, which we learned what is complete Dechallenge, what is partial Dechallenge, what is positive rechallenge, what is negative rechallenge, and when we can do rechallenge. Yes. So this is about challenge, Dechallenge, rechallenge. Very important interview question for pharmacovigilance at any level. If you are going to give interview for freshers, then also important. If you are going to give interview for experience level, then also it is important. Yes. So please remember these concepts, because in the next video I am going to tell you about causality assessment. Like what is causality, how we assess it, what are factors we check. So there in causality assessment we check for these Dechallenge, rechallenge concepts. Yes. So if you really like this video, if you got a clear-cut understanding of these challenge, Dechallenge, rechallenge concepts, and if you really like this video, please don't forget to like, subscribe and share our channel to your fellow friends who are looking for interview questions. And with this, I am going to conclude this video. We'll be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, aware, healthy, updated. And one thing I forgot is, please mention below any doubt of yours or any confusion you have after listening to this concepts, please comment below in the comment section and I will love to read all the comments and will be replying soon. Thank you. Have a nice day.